Hello, Jay. This is Steve from New York. I'm a healthcare provider, so very interested in the conversation that's been going on lately in terms of what we can do with Obamacare, et cetera. One thing that's been kind of driving me crazy, though, is just hearing how, I don't know, maybe simplistic some of the comments are, et cetera. Healthcare, it turns out, is horribly, horribly complicated in the United States, and I don't think it's as simple as a yay or nay on Obamacare or tweak this, change that, et cetera. This is a massive problem that's not going away anytime soon. Part of the problem, I think, and I say this, again, being a healthcare expert, is that we spend way too much time paying attention to insurance companies and insurance in general. I'm not saying that's not a problem. Of course it is. We need to fix our insurance industry. The biggest problems, of course, are the fact that the industry in itself is for profit, and that creates a whole lot of problems. But again, it's more complicated than people think. One of the terms that keeps getting bantered around, that's both here on Best of the Left as well as elsewhere, and this has been the case for a long time, is the term single payer. Single payer can be good. Single payer can also be bad. Many countries that have universal coverage, many countries in Europe, Canada as well, they are not single payer countries. We tend to misuse that term a lot and think it's just the holy grail for healthcare. But while it can be the right way to go, it also can be the wrong way to go. So in other words, just to recap that, there's a big difference between single payer and universal coverage that's affordable. Furthermore, Obamacare, or the Affordable Care Act, as we should probably call it, in itself is a conservative Republican plan that dates back to the Richard Nixon administration. It's been pretty well documented in the scientific literature, and if people aren't aware of that, they should seek out some sources. All of that having been said, if insurance isn't just our only problem, then the question becomes, what do we have to deal with in order to make our health insurance industries more affordable and equitable and just? And the list is very long. It includes, but certainly is not limited to, as I said earlier, the for-profit nature of insurance companies, but also in many instances, it's the for-profit nature of healthcare facilities. We also have to be mindful of the fact that the costs of healthcare are not known to the consumer when they walk into the building. It's a very big problem in terms of being able to shop around and pressure businesses and insurance companies to make sure that the system is more affordable. This includes, of course, drastically different costs for the same exact procedure, sometimes within the same county. There's been very good research on this that people can find online. We also have to consider the fact that our regulatory industry, when it comes to pharmacological companies, is horrible. So these massive multinational for-profit publicly traded companies are allowed to siphon a massive quantity of money out of our pocketbooks when it comes to our healthcare industries. This is not the case in many other countries, whether they are single payer or not single payer. We have the same problem when it comes to the manufacturing of medical devices. For example, in the U.S., sometimes an MRI machine can cost $3 million, whereas in a country like Japan, it could be $300,000. And that's because the federal government puts a regulatory cap on how much you can charge for certain products, et cetera. We have to, of course, factor into the equation the excessive cost of higher education. And on a less obvious note, if you really dive into the healthcare research, you're going to find out that our educational programs are horribly antiquated, and they lead not just to the death of literally hundreds of thousands of people per year, but the ubiquity of the problem of misdiagnosis. This is probably the biggest factor that people don't talk about and is, of course, driving up the cost of healthcare, because if you're paying for bad services that aren't effective and efficient, the net result, of course, is the fact that you have repetitive bad services, because individuals are just going to keep going to new providers, new clinics, new hospitals, trying to seek a solution because the first, second, third, and maybe 10th person did not solve their problem when in fact they should have. Another fair criticism of our system is that we tend to because of our for-profit nature, to take care of diseases as opposed to health, so disease care as opposed to health care. And then making matters yet more complicated, just like we have food deserts, we also have healthcare deserts in this country, because healthcare is such a for-profit entity. It causes usually poor neighborhoods, et cetera, minority neighborhoods, to not have access to high-quality healthcare. And while there's no one source that's perfect in terms of what we need to do with healthcare, I would certainly point people in the direction of T.R. Reid's book, The Healing of America. He takes one shoulder problem to 10 countries and uses the experience to, through the lens of experts, analyze their healthcare systems and talk about what's good and what's not good. He even dives into some of the important variables, like the difference between universality and single-payer healthcare systems. It's certainly a good place for people to start if they're interested in the topic, even though the book is at this point a wee bit outdated. So, I want to implore people to think more about this, do a lot of research, and especially those groups that are seeking to act on reform, we should make sure we're heading in the right direction before we take our first step. Keep up the great job. I love the show.